You would think that coming to a cancer center would be kind of sad and kind of a depressing thing. And we actually look forward to it, because when you're there with the team, it's so optimistic and upbeat and positive. I noticed a little lump in my armpit, and my sister's a nurse, and we were on a hike, and I, let her feel it, and she said she thought that I should probably go get it checked out. At that point, the surgeon, when he realized it was melanoma, didn't really know a lot about melanoma and kind of gave us some pretty grim news. That part of it is a little bit of a fog to me just because it was shocking. I was in a lot of disbelief at that point. Luckily, my sister's a nurse, and she really kind of just took over at that point and did a lot of research, found places for us, one of which was NYU.
Kate Coulter was a bit sick when she started therapy when I first saw her. We moved quickly to get her on to treatment at Perlmutter Cancer Center. We take a very aggressive approach. You never get rewarded in melanoma by being passive, so I think it's a pretty active, aggressive approach to treat the disease, and we'll always try to put someone on a trial if that trial is available, with the idea that you're not going to do worse and you may do better by going on a trial.
We talked a lot about that, specifically my sister and I, a lot about what we were looking for, and that we weren't going to just jump into any trial, but that we really wanted to research it and talk to Dr. Weber and the team when we got there. His description of it and what they were doing, and also the success that he had had so far, made us really feel like that it was the obvious best choice for me.
A clinical trial is an investigation. And a lot of patients come to see you and they don't really know much about it, of course. It's been a very good news trial. It's what would be our standard first-line approach to give 3 drugs, 2 standard drugs plus a third drug, to try to reduce side effects and to increase the effect of the treatment. And that was perfect for her, and she's done very well. It's had great shrinkage of tumor, doesn't have a lot of tumor left, and continues on probably 36 weeks into it.
I feel fantastic now. I feel great. Mentally, I feel great because I know that it's working. Every time I go for my scans, again, thank God, I see that the cancer is regressing.
The median survival 10 years ago was about 9 months. Today, the median survival can be as long as 6 years. That's a big difference. And we never used to utter the C word, the cure word, but now we talk about cure all the time.
Coming to Perlmutter Cancer Center, I felt like I was absolutely in the right place and that I was in supportive hands, and I was in the place where I was going to get cured. I would tell somebody who has this diagnosis that, I'm sorry, but that it's not, for lack of a better word, it's not a death sentence anymore. It's something that it can be treated, and this is the place to do it.